their decisions and lift the bans they have imposed before any further damage is done on our economies and to the livelihoods of our people.
Let's take you now live to this briefing. The Minister of Health, Dr. Joe Phaahla, and the Deputy Minister of Health, Dr. Sibongiseni Dhlomo, with a panel of scientists are briefing the media, unpacking President Cyril Ramaphosa's briefing last night. Let's take you there live.
Honorable Minister, to do the opening and welcome. Over to you, Honorable Minister.
Thank you very much, Foster. Thank you. And good morning to all the panelists. Good morning. And thank you very much for responding to our request at a very short notice. We know we are dealing with a very a difficult matter, a matter of public interest. It has caused a lot of anxiety with not just because of the report about the variant and the rising in infections and the likelihood that we have entered or the beginning of a fourth wave, but also, of course, the reaction of some of the countries which have made life more difficult. So this has made this matter even more of public interest to all South Africans. And we felt that we need to keep you informed in terms of where we are. I want to therefore thank all the panelists really for giving their time. I know all of them have got very busy schedules, and we appreciate your time. I know that Prof. Abdul Karim will leave us in about half an hour because of another engagement. As we know, this week on Wednesday will be the World AIDS Day, and as somebody who's very intrinsically involved in management and research in the area of HIV and AIDS, he's got other commitments for the day. But we highly appreciate him having given us this time. Now, let me just reiterate the message of the President last night, that indeed we want to say to all South Africans that there is absolutely no need to panic. We
recording in
that,
progress.
There is just no basis for some of the leaders of countries which have imposed these restrictions on traveling for us in South Africa and other countries in Southern Africa. There is no basis for South Africans to panic. We've been here before. This is no new territory. We are now more than 20 months experience in terms of the COVID-19, the various variants, the various waves. And we want to again thank our scientists, Prof. Tulio de Oliveira, and the team also with Professor Karim and NICD and all our team which is here. It's often said, you're better off dealing with an enemy you know than an enemy you don't know. So you can imagine if we're just seeing infections rising, we didn't know what was it about, what was the cause. And thanks for their diligent work, we now know that it is driven by a variant, but also thanks to the WHO for giving it a name. We will not only just say there is a variant with this number, we now know its name is Omicron, thanks to the WHO. Now our medical scientists, our epidemiologists, our clinicians are working daily, hourly, studying this virus, its characteristics, and its impact on us as human beings, as citizens. Among the things which the President outlined yesterday that we still have to understand, led by our scientists, such as the transmissibility of this virus, that's a matter which our scientists and epidemiologists are working on, whether there is any age differentiation in terms of its transmissibility and illness, whether there is increased reinfection for those who had already been infected before, and including also breakthrough infections for those of us who are already vaccinated, and also to the extent to which the vaccines remain of serious protection. All these matters, what the President outlined as work in progress, we can be rest assured that it's a matter of days and weeks, our scientists will have actually gone to the bottom of this. But in the meantime, we are doing everything possible to make sure that our health facilities are ready. We know that as the infections rise, people will get sick, some will get severe, especially those who have not been vaccinated. But we know that there will also be incidences where even those who are vaccinated may get ill, and the health facilities should be ready. And that's why we have a Gauteng representative here, just to shed light as the epicenter currently of this variant, to give us a sense of the readiness of the health facilities. Now, under the leadership of President Ramaphosa, we're also engaging leaders of various countries, especially those who have initiated these travel bans, to convince them that indeed this is very unnecessary. And in doing this, we are happy that we are supported by the World Health Organization. Just yesterday afternoon, at about 6 in the evening, I had an engagement on the request of the U.S. Secretary for Health and Human Services, Mr. Javier Becerra, who was accompanied by a high-level team, including the head of the CDC of the USA. And Mr. Becerra expressed his appreciation of our medical scientists and also appreciation of the stance of South Africa in terms of making sure that as early as we could, as soon as we knew that there was this variant had been identified, we're ready to share the information with the world. And he pledged support in his capacity as the Secretary for Health and Human Services for the US. But in my response, I said to him that while we appreciate the support, we know that we've come a long way with the Americans. They are supporting us in the fight against HIV and AIDS through the PEPFAR. We get quite a good financial support from them, and also the contribution they've made in donating just over 7 million Pfizer vaccine doses. But I said to him that while we appreciate that, and also his expression of support for our stance in sharing the information, the action of his government doesn't say that to our people, to us as South Africans and to our people. And so my message to him when he asked, what is it which they can do to support us? I said, what you can do is to say to your president and your government that the travel bans are not helping us. They're just making things more difficult. And it's in contradiction to what you are saying, that as the American government, you are actually in support of the approach which we have taken. So that is the message which we gave. Minister of Derko, Minister Pando, and various ministers and the president are also engaging leaders of various countries in Europe and the Americas. Now, the WHO Afro, the regional director, Dr. Mweti, also sent us a statement which they have issued as WHO, which also condemns the travel bans and warns all these countries that this is counterproductive, that while we're calling for openness and sharing of information, by doing what they've done, they're actually being counterproductive. So we welcome that statement. And later today, the World Health Assembly is convening. It's starting actually, it just started now at 10 o'clock. So we'll be joining the World Health Assembly, a special World Health Assembly, which is dealing with strengthening the world response to the COVID-19 pandemic. Later in the afternoon, we will be presenting a statement on behalf of Southern African countries to condemn the action of those who have imposed travel bans. So this is also mobilizing other countries on the world platform to express our outrage at the travel bans. Now, as I conclude, I want to just say again, to reiterate the call made by the president last night, that our best, response to this will be if more South Africans come forward to take the vaccine. This is the only way, is the best weapon over and above the non-pharmaceutical interventions, the best weapon in our hands to make sure that we can, fight back this variants and the pandemic as a whole. Thank you very much. Let me invite Prof. Abdul Karim to take the floor on behalf of the scientists With your permission, Mr. Foster Mohale, can I invite Prof. Abdul Karim? I know he's got a bit of pressure of time. Over to you, Prof.
Thank you very much, Minister. It's a great pleasure and honor to be here. What I would like to do very quickly in the next 10 minutes is just to give you a very quick overview of what we know and what we don't know as we deal with this situation. So let me see if I can get this taskbar. I can't seem to get it to be full. There we are. No, sorry. Okay. Oops, sorry. That's not the right thing. I'm trying to get to show taskbar. Okay. No, I couldn't get it to be full here for some reason. Hide presenter view. Here we are. Done. Okay. Thank you very much, Minister. It's an honor for me to be here with you today. I'm going to very quickly go through what we do and what we don't know about the Omicron variant and how is that guiding us in the way in which we are responding. I'm sorry I can't stay with you for the entire session because I'm speaking in a World AIDS Day event shortly, but let's quickly go through it. Firstly, if we look at the global situation, we can see at a global level, the world has been through a first wave, second wave, third wave, and the numbers are now steadily increasing across several continents now. And so we may be at a global level entering a fourth wave. And we know that the variants have changed the COVID-19 endgame. We know that the variants have now led to a situation where we cannot simply hope that we can use public health measures and vaccines on their own. We've got to be, vaccines on their own. We've got to be looking at dealing with the variants as new ones arise. And so in changing that, our main concern, and why are we concerned about variants, is because of what we've seen in other countries and indeed in our own country. Here, I'm presenting here the first waves in India, Brazil, and South Africa. If you look at all three of those first waves, you get some idea of what we were dealing with back in the first half of last year. But look at what happened since. The Delta variant drove a severe wave in India, and I think we all saw the heart-wrenching pictures on our TV screens. We saw how the Gamma variant drove the epidemic in much of Southern America. And in our own country, we saw how the Beta variant drove our second wave and the Delta variant drove our third wave. And so we have some idea of the challenges we grapple with in dealing with each new variant. And if we look at the epidemic and the state of our current epidemic in South Africa, what we are seeing now is a rapid rise in cases. And I think all of us have been quite amazed at how fast the numbers are going up, given that we were in low transmission until barely a week ago. And when we look at this increase, we would have to understand what's driving that increase. And it's due to the excellent research that has been done that has identified what is potentially a major source of driving this new increase in cases. But let me just make this very clear. We were not caught with our pants down. We expected and prepared for a new variant and a fourth wave. As far back as September, at the Moseneke Commission, I basically outlined what I anticipated would be the trajectory of the pandemic, just based on what we've known about the first three waves. And if we look at that situation, what did we do? Well, government invested together with many other agencies in building the capacity to do genomic sequencing in Africa and particularly in South Africa. And so in South Africa, that investment has now paid dividends through this broad national consortium led by Professor De Oliveira and the NICD. And what we have seen is that they have delivered. They have given us the best fighting chance by giving us evidence early that we're dealing with a new variant. Now, so we've been expecting this, and we anticipated it would come. We didn't know exactly when it would come, what it would look like, but we had some ideas and some predictions about what was the likely scenarios. So when we look at this particular new variant, we don't know much about it itself. So we don't really know how it behaves. We don't know how it is, how transmissible and so on. Those estimations will come with time. But what we can do is we can extrapolate based on the mutations we are seeing. And so we can get some idea of what's the likely scenarios, and we can plan and we can prepare and respond based on those likely scenarios. And if you look at the likely scenarios, well, there are a whole range of mutations that we know well. We know them well because they are already in the alpha, beta, gamma, and delta variants, and we know what they do. We know that, for example, a set of the mutations and deletions that occur are responsible for changing the way one particular PCR test responds. And so it becomes a marker that helps us identify it. We know that some of the mutations we see in this particular variant are also in the Delta variant near the furin cleavage site, and so they enhance transmissibility. So we can expect this new variant will have enhanced transmissibility. We know that this variant has some mutations similar to the beta and gamma variants that are responsible for some level of immune escape. So we will expect that there'll be at least some partial escape from antibodies. So we can predict this or put it together a scenario based on what we are seeing in the mutations. But there are some mutations in this particular variant that we have just only slight information about. We don't really know fully well what they do, but we have some inkling. And then there are a whole lot of mutations. We have no idea what they do. And so a lot about this variant, we simply don't know, because this is a constellation. It's not about only the individual mutations. But what can we reasonably expect from this particular variant, and how will it impact the key elements of our response? So let's look at that. Let's look at, are our current diagnostics going to be effective? Well, it's picked up on at least 2 of the 3 genes in the Thermo Fisher kit, so we expect that it would do quite well. Our diagnostics should function well. We've got no reason to be concerned, hence the smiley face. In terms of clinical presentation, there's not enough data yet. We've seen some anecdotal information. We've seen, clinicians commenting, but you have to understand that patients coming into a clinical setting are biased in terms of their severity and what we are seeing. What we are seeing is anecdotal information suggests similar presenting illnesses, mainly in younger people for obvious reasons, in that younger people are less vaccinated, so you will see more cases there. But we simply do not have sound, reliable data on the clinical presentation, but we have no red flags that have been raised so far. So we can't be complacent. We need to monitor the situation. We don't know where we stand, so no smiley face, but we're monitoring that, and we should have more information on this, and some of which you will hear in the course of this briefing. The third is, our current treatment still effective? Yes, smiley face, because we know that most of the things we use in our standard treatment protocols should be effective. There's one area that's not clear, and that's on monoclonal antibodies, and that remains to be tested. We don't really widely use them in South Africa, so they don't really impact on us. There's new potential treatments coming into play, like Paxlovid. I won't go into that because that's more complicated to share with you, and I can always cover that in later time. So as far as diagnostics, clinical presentation, current treatments, we've got really no reason for concern. What about our public health interventions? Our public health interventions all work. Social distancing, ventilation, all the usual things, they work. The area that has created the concern and this global overreaction is that we're not sure about whether the current vaccines will protect against this new variant. And there's some evidence, preliminary as it is, that we can see that the mutations that occur may confer some level of immune escape from antibodies. And so we can expect that we may see more reinfections. So those who've had natural infection without being vaccinated, we may see them getting infected again because this variant will bypass some of that immunity. We may see that in terms of the antibodies generated by the J&J Pfizer vaccines, we don't know how that will respond. It's left to be seen. We'll know definitively, and probably take us a good 2, 3, maybe enough to 4 weeks to get those answers. But based on what we know, and based on how the other variants of concern have reacted to vaccine immunity, we can expect that we will still see high effectiveness for hospitalization and severe disease, and that protection of the vaccines is likely to remain strong. Now, I don't know this definitively. The studies are being done, but based on what we know, we can expect that this is the likely scenario, that the vaccines should hold well in terms of preventing hospitalization, severe disease, because they depend more on T-cell immunity and less on antibodies. So even if there's some escape from antibodies, it's very hard to escape T-cell immunity. So that's the likely scenario that we are to see, I'm expecting. Now, more Omicron is expected to have an increased risk of immune escape, and we may impact on the clinical efficacy of vaccines, but we know this. We've studied this here inside, we've studied it globally. AstraZeneca, for example, that was highly effective at 70% against the D614G variant, was only 10% effective against the beta, but it was 60% effective against Delta. So we understand that different vaccines might react differently, have different levels of protection against particularly mild infections. And so we've seen that with the Pfizer-BioNTech vaccine, 91 to 95% protection against D614G. And, pretty high protection against the beta variant, as we know from the study of the original Pfizer trial that included South Africa. But against Delta, we started seeing lower levels of protection from the Pfizer vaccine. Still pretty good, but slightly lower than what we were seeing previously. So this is not unexpected. We know how to assess this, and we'll know how to adjust our strategies accordingly. What we do know, and this comes from many different studies, and I'm sharing with you just some of them. This is a study of 230,000 people in Qatar, 3.4 million people in California, 8.8 million people in New York State, and the whole population of Israel. What we're seeing is that even over time, the protection of the vaccines against the different variants, including Delta, has remained pretty good, usually above 90%. And it doesn't matter which vaccine we're talking about, they tend to do quite well in protecting against severe disease, because that's our big concern with this disease. We do not want to end up in a situation where our hospitals are overwhelmed with clinical illness and patients with severe disease. So our vaccines will provide us with some protection. So Omicron was first described in Botswana and then shortly thereafter in South Africa. And the fact that it was so early in its description and picked up is a scientific success. It's a success of the investment that our country has made in science. South Africa and the world now needs to convert that scientific success to a response success. And as you already heard, the last thing we need is panic and overreaction. And certainly what we've seen in knee-jerk reactions is really uncalled for. And we've dealt with variants before. It's not new. Our country has dealt. We've been among the first to describe variants before. So we know how to do this, including how to deal with variants with immune escape. Closing the borders has almost no benefit. Well, no benefit for two reasons. As of yesterday, there are already 11 countries reporting cases of Omicron. So, trying to isolate South Africa or even Southern Africa is not really going to help, because pretty soon many other countries are going to become avenues of spread of the virus. But more importantly, we have existing 5-step strategy that actually does very well in reducing travel transmission risk. We already know how to prevent and reduce the risk through travel. And that's by ensuring that only vaccinated people travel. You do symptom screening at boarding. You ensure they have a negative PCR result at boarding. You have a mask during the flight. And lastly, as I've just seen, having gone to France for the meeting at the Pasteur Institute, you get a COVID test on arrival. That is the way in which we can protect ourselves. You can add in additional requirements like quarantine, self or mandated, but we can deal with this. Just at a time when we have a new threat in this pandemic, when we should be standing together against the virus, we end up, standing against each other. We end up putting fences between us instead of, dealing with this and understanding what the enemy is and how that we need to tackle it together. So there are three things that, I believe need to be done to deal with this virus, and our response needs to focus on that. The first is we can expect that higher transmissibility is likely, and so we're going to get more cases quickly. We're already seeing early evidence of this, and if that happens, the cases concerned, I'm expecting we'll top over 10,000 cases by the end of the week per day. We'll see pressure on hospitals within the next 2 to 3 weeks. And even if Omicron is not clinically worse, and certainly the anecdotes don't raise any red flags just yet, but we don't know for sure, we are going to see this in all likelihood because of the rapidity of transmission. In a way that in which we saw with the Delta variant, a very rapid rise in cases and huge pressure on the hospitals in Gauteng. Our public health measures work, so let's use them. Mask wearing, ensuring that we follow all the rules. I won't go through them right now, but things we know very well. And then finally, our biggest challenge is going to be to prevent super spreading events that will just put us out of control, and to ensure that we reduce the risk of transmission, particularly indoors. And to do that, even though we're likely to see more reinfections and breakthrough infections, the vaccinated people will have they are less likely to have severe COVID. And so one of the things is to restrict risky situations, particularly indoors, to vaccinated only people. And that's part of the strategy and the direction in which we should be heading. On that note, Minister, thank you very much. I'm sorry I have to leave you, but I hope that was helpful.
Thank you very much. Thank you very much, Prof. I'm sure you leave us with a very capable team, which will take us through further and answer the questions. And keep your phone on silent. If we get stuck with some difficult question, we'll WhatsApp you, and you can. But I'm sure we've got a very capable team here, which can deal with those. But this is not the end, as we say. This is a marathon. It's not a sprint. So as we go through this marathon, we will always tap on your knowledge and experience. Thank you very much. Back to you, Foster.
Thanks, Minister, and thanks to Dr. Karim for that comprehensive presentation. Without wasting any time, I'm going to call up. We're going to get a presentation on epidemiological update as far as this variant is concerned. I believe Dr. Michelle Groom is going to give us that update. Over to you, Dr. Michelle.
Yes, sure. Thanks. Just trying to share my screen. All right. Can you see my screen faster?
Yeah, we can see the screen, Michelle.
You can see. Just
Thank
put
you.
it on.
Yeah, I'll put on. Yes. There we go. Thank you. Is it fine now?
Yeah, I can just put it. Oh, yeah, no, it's fine.
Okay,
wonderful.
Great. Good morning, Honourable Minister and colleagues and viewers. So I'm just going to give you a brief update, I think just in terms of where we are in the epidemiology. So this is really just our lab confirmed cases. And you can see we'd actually, towards the middle of November, had the lowest case numbers that we had seen really at any point since we had started the pandemic. We talk about the 7-day moving average, which is really just to even out the number of cases that we see on a daily basis. We know that often over the weekends that we see slightly lower cases. And so the 7-day moving average gives us a good indication of this. And so in mid-November, this was less than 300. And you can see that we have seen a rather rapid increase in terms of the number of new cases. We were sitting at the 7-day moving average of just under 2,000 at the moment. We also have a look at these are the number of tests in the bars. So you can see that the testing that we were doing during this period after the wave, very similar to what we were doing between the second and third wave. And the one metric which we really use is the percent positivity, which is the number of new cases each day out of the total number of cases of tests that were done. And you can see our positivity rates were also at the lowest that we had ever seen, since the start of the pandemic, at around 1%. And you can see there's been this rapid increase in the percent positivity over the last 2 weeks. Just looking at this by province, so the blue here is Gauteng. So you can see most of this has been driven by case increases in Gauteng, but we have also seen increases in Limpopo, Northwest, and Mpumalanga. In terms of the age groups, so towards the end of the third wave, we saw quite significant increases in our younger age groups. At this stage, a bit difficult to see in this graph. I'll show another one now. We can see that this has been driven mainly by our younger age groups. And this is really a factor of that the younger age groups are really those that are more likely to congregate, more likely to go out and socialize, and thus similar to the second wave we saw last year, very much started in these younger age groups. So if you look at the percent positivity by age group, once again, you can see most of this is driven by the under 25-year-olds, but we do get spread now to the other age groups. And so while the increased number of cases were initially found in several of the tertiary education centers in Tshwane, you can see that we have now spread into the other age groups. In terms of sex, I think we have had a very similar pattern between males and females, slightly increased incidence in each of the waves in terms of females, but this is cases and may just be that females are more likely to present to health services. But at the moment, no significant differences between males and females. So just to focus on Gauteng province, because this is really where we have seen the increase in cases. Very low case numbers mid-November. We were seeing about less than 100 in terms of our 7-day moving average. And this has now crept up to about 1,500. So I think most of the increases in our daily case numbers at this stage are from Gauteng, making up about 80% of those cases. And very similar to our national picture, we can see really driven by the 10 to 14-year-olds, 20 to 24-year-olds, 15 to 19-year-olds, and slightly in the 25 to 29-year-olds. And I think really striking that, at the beginning of November, we had very, very low positivity rates. And so there has been this tremendous increase in the last 10 to 14 days. So I think I'm going to stop there and just hand over to one of my colleagues, just to update in terms of hospitalizations. So this will be Dr. Jassat.
Good morning, Honourable Minister and to colleagues and members of the media. I'm going to carry on from where Michelle stopped, just to give you an update, particularly focusing on the Tshwane resurgence that we're seeing, and giving you an update on hospital admissions over the last few weeks. So as you know, DATCOP is a hospital surveillance system that was developed by NICD and the National Department of Health. And we currently have 408 public hospitals and 258 private hospitals that report COVID-19 admissions to DATCOP daily. When we look at admissions, the 7-day moving average nationally, after the peak of the third wave, we saw a decrease to low numbers, and we're starting to see a slight increase nationally. And what we see on the right is that the increase is evident in both the public and the private hospital sector. When you look at the daily average of admissions in the current 14 days and compared to the previous 14 days, we can see that there have been significant increases in Gauteng from 18 admissions a day to 49 admissions a day in the past 2 weeks, and a small increase in admission average in Northwest. But the other provinces are still not yet showing increases in hospital admissions or deaths. Let's go to Gauteng now. On the left, you can see the number of cases in orange and the number of hospital admissions in grey across the 3 waves. And you can see the sharp increase in cases and admissions now, since week 45. On the right, we track the percentage of cases that are admitted, and usually during the peaks of the waves, a lower proportion of cases are admitted because only the very sick get admitted. And after the waves, we tend to see a higher proportion of cases admitted. So currently, we're still seeing a very low proportion of cases admitted. However, when you look at the week-on-week change, you can see the very steep rise in the week-on-week change in cases, and similarly with admissions. And acknowledging that admissions always lag by a week or 2 after cases, you can still see, compared to the first 3 waves, a very sharp week-on-week increase in Gauteng in this 4th wave. Looking at Gauteng's admissions, you can see in this resurgence an increase in both the public and the private sector. And on the right, you can see the number of admissions by district, and you can see the earlier increase in Tshwane Metro, and then you can see the other districts starting to increase. Thankfully, for now, we're not seeing any increases in deaths in either public or private sector and in any of the districts. And when you look again at the current 14-day daily average and the previous 14-day daily average, specifically for districts in Gauteng, you can see now that all districts have shown an increase in daily admissions over that period. The biggest increase being in City of Tshwane, and the other districts showing small but steady increases. Now on to Tshwane Metro. In the last 2 weeks or so, we've had about 455 admissions, of 253 in public sector and 202 in the private sector. 8 people have died, 200 have been discharged alive, and 219 are currently admitted. There's been a very sharp increase in admissions in a few hospitals, with the highest numbers of admissions particularly increasing in the last 10 days or so in Tshwane District Hospital, Steve Biko Academic Hospital, Jubilee, Medforum Private Hospital, and Mamelodi Hospital. When you look at the numbers of admission by age, and this is 1-year age bands, you can see that what we normally see is a large number of admissions in older people. But in this early resurgence in Tshwane, we're seeing most admissions in the 0 to 2-year age group, a large number of admissions there, and we're seeing a large number of admissions in the middle ages, sort of around 28 to 38. But when you look at the incidence risk of admissions, where you divide the number of admissions by the population size, you can see that the highest risk of admissions is still in the very oldest, the over 65s. And it's been increasing in all age groups over the last 6 weeks. This is the percentage of cases that are admitted by age group. And so you can see that the percentage in the middle ages are quite low. Less than 10% of cases are being admitted. But very high proportions of young children are being admitted. And of course, as we'd expect, higher proportions of older people are being admitted because they usually present with more severe disease and are at risk for more severe disease. Looking at the percentage of admissions that have comorbidities, as we would expect, most of the older groups have comorbidities and are admitted with COVID-19. The percentage of younger children admitted with COVID-19 with comorbidities is quite low. This is the percentage of admissions in Tshwane with severe disease, and you can see that it's higher in the older groups, and in the younger groups under 60, it hovers around 25 to 30%, which is what we've seen across the rest of the pandemic. There's been very few deaths, just 8 deaths thus far, but you can see most of the deaths have been in the older groups, 60 to 69 and over 80. Now, this is the proportion of admissions that are severe in Tshwane Metro, and as you can see that during the peaks of the waves, we have a higher proportion of patients who are admitted who are severe, and after the waves, that decreases. Currently, the proportion of patients who are admitted with severe disease are quite low and lower than what we've seen across the rest of the pandemic at about 60%. And just to zoom in on the last 7 weeks, you can see we've had a sharp increase in the number of patients admitted with not severe disease compared to the number of patients admitted with severe disease. And just finally, this is very incomplete data, but I thought worth sharing. In all the admissions in Gauteng, about 25% have known vaccination status in DATCOV, and you can see the vast majority of patients, new admissions and the current inpatients, are unvaccinated people, with a much smaller proportions of patients admitted being fully or partially vaccinated. I thank you for your time. Let me just go through a quick summary. We've seen increased admissions in Tshwane Metro, both in the public and the private sector. We are starting to see increases in other districts in Gauteng in hospital admissions since the past week. There's a sharp week-on-week increase, and that's important to note because for surge preparedness, we know that when the hospitals become overwhelmed very quickly, there's less capacity and there's more mortality, and so we really need to look at surge preparedness, both in Tshwane Metro, the other Gauteng districts, but also the other provinces. The increased admissions we're seeing in young children under 2 could be just precautionary. We don't have enough information yet, but the indications are not that they're more severe than they have been in the past. But I think what's important for us to note is that while we do hospital surge preparedness, this time we may need to look at pediatric bed preparedness especially. It doesn't look at the moment as if there's any signal towards increased severity, but it is early. Admissions do lag by about 2 weeks after cases, and it takes some time for patients to have an outcome. So I think this is something we'll watch and hope to give more information in the coming weeks. And interesting also is that most admissions are in unvaccinated individuals. Thank you very much for your time.
Thanks very much, Dr. Wasila and Dr. Michelle Groom, for that input as far as the epidemiological report is or update is concerned. On that note, I'm going to swap my presenters. Instead of getting the clinical observations from Dr. Unben Pillay, I'm going to call upon Dr. Hongwana from Gauteng Health to give us the state of readiness as far as the province is concerned in terms of facilities, oxygen, ICU, and the likes. So I'm going to hand over to Dr. Hongwana. Dr. Hongwana? Doc?
I'm switching on my video.
Okay, and just also adjust your camera so that the people can see you. You are live on TV, the camera TV are, but yes, now we can see you.
Yeah, okay, thank you very much. And Mahali, I was going to send a presentation, but apparently it's not coming through, and I'm not familiar with this system of Zoom, but I will engage with everyone. We currently in Gauteng have 4,407 functional beds. Remember, Gauteng Health has got 18,344 beds prior to COVID, but this number of 4,407 were the beds that we had at the peak of the third wave. And we decided as Gauteng Health that we will take these resources to the fourth wave. It is from lessons learned. When we started with the third wave, we were at about 2,000 beds, and we have what we call a risk-adjusted, demand-informed strategy. So as the peak of the third wave went up, we increased until we came up to 4,407. We decided from the end of the third wave that we are going to continue to monitor these beds that we have been allocated to COVID-19, the 4,407, and these will be our resources that we will take to the fourth wave. So we have been preparing for the fourth wave since the end of the third wave. Secondly, with security of oxygen, during the third wave, we had daily meetings with our folks where we monitored the bulk oxygen tank, even during the riots, including the cylinders, the availability of the oxygen cylinders. And we noted during that period that the oxygen cylinders are strategic in us managing the pressures that is there in terms of patient care. So we are currently having meetings with our folks on a bi-weekly basis. And when the fourth wave hits us, we will go back to our daily meetings. We also developed a WhatsApp where we daily monitor what is happening in the facility. So in terms of security of oxygen, we can boldly say we are secured, because that's exactly what we went through the third wave, and we've been monitoring that throughout. And we intend to take the same strategy and approach for the fourth wave. In May 2020, Gauteng did not have specific COVID-19 posts. We had a staff complement of about 68,000. As we speak at the moment, we have a staff complement of 6,000 for the COVID-19 contracted personnel. And this contract ends at the 31st of March 2022, and we have submitted to our principals that we need that this post continue for the financial year 22-23 in terms of sustaining stability and also lessons learned. We have a cohort that have currently is experienced in managing COVID-19. We're not dealing with variants in terms of when patients come into our facilities, we're dealing with individuals. Of course, the information we have received from Prof. Salim and all the other experts in our country help us to actually have an attitude that says we need to defeat this COVID, irrespective of the various variants that it presents with. So we are prepared. So we have moved from 68,000 last year. Currently, we've got a staff complement of 81,000. Remember, we are not the Department of COVID-19, we are a Department of Health. We still have to deal with the other healthcare needs of our population, of our communities. So we still need to redress and address and manage whenever a patient presents in our facilities. We've got 4 academic hospitals. Charlotte, we're happy that it is functional, even though not to an extent that we desire due to the fire, but the expertise that are there are highly appreciated, because remember, the first patient in South Africa was managed in Charlotte, who was diagnosed with COVID-19. So the expertise of Charlotte remain very, very critical for us as one of the 4 academic centers in Gauteng. We've got 3 tertiary hospitals, and we've got a number of regional hospital and district hospital. We have about 38 facilities in Gauteng, and about plus minus 300 clinics that we have in Gauteng. So the attitude we also are maintaining since the decline of the third wave is to constantly monitor our PPE that we do with supply chain, the security of water, the security of power supply. We're monitoring our generators, the security of waste management, the security of laundry services, the security of pharmaceutical supplies. So we are constantly monitoring those key issues because they are very important in making sure that our experts, that is our staff in the forefront, in the trenches of fighting COVID-19, are well supported. We also are noting on a regular basis the issue of the psychosocial needs of our staff. Because when you have a war, you have to make sure that your soldiers are looked after very well. And if there is security of oxygen, there is security of PPEs, there is security of power supply, security of water supply, that makes the battlefield more aligned to us winning over COVID. We cannot deny there are challenges. And the other issue that we have is we need to reassure our communities that we are ready for COVID-19, fourth wave. It's like the cricket staff, the cricket team of South Africa, the Proteas. If they're going to play England again, we cannot judge them in terms of their losses to England. We have to have confidence that they are going to do their best with playing cricket against England. We have played or battled and combated COVID-19, the first, second, third wave. We're ready to combat it for the fourth wave. It's lessons learned. We have a dashboard that we monitor our beds on a daily basis. It is live. We check it every day. We're monitoring also our ABTs in Bronx Strait, in Josh Mukari, in Bara, in Anglo Ashanti, as to the occupation of those facilities. So we have bed capacity. We have a continuum of still employment, of engagement with our HR to make sure that we still fill up the 1,000 beds that are needed, not 1,000 beds, the 1,000 posts that are still needed to enhance the battle and combat for COVID-19. We are collaborating with our expertise, public health specialists. We are collaborating with our emergency medical services. We are collaborating with academia. We take every note very serious. We're collaborating with our communication systems to make sure that information that is sent out in the community is information that is reliable, in order for us to mitigate against doubts, mistrust, and any aspersions that are thrown to us healthcare systems. Let us reassure our communities that we have very dedicated and very, very committed healthcare workers in our systems. People that are experienced and very committed. The 81,000 healthcare workers in the Department of Health are committed to face the fourth wave as we have faced the third wave, as we have faced the second wave, including the first wave, in the interest of making sure we win. Nobody will ever really tell us exactly how it's going to behave when it hits us, but we are prepared as we are ready to make sure that we respond. Our approach, risk-adjusted and demand-informed strategy will still be implemented. In the concept of highly reliable organizations, you create redundancy, you create a common mindfulness, and you create checklists, which we have at the moment, and we are monitoring on a daily basis the admissions in our hospitals. We are monitoring our 4407 dedicated COVID-19 beds in our hospital. We are accessing all the systems, your EVDS, your DATCOV, any system that has been presented to leverage the combat of COVID-19. These are resources that are available to us as the Department of Health in Gauteng. And one of the key issues in highly reliable organizations, you defer to experts. And we have got expertise in our academic hospitals, in our tertiary hospitals, and regional hospitals. And we have the confidence that they will take clinical decisions in order to increase this base from 4407 to a figure above 4407. It will be a risk managed approach, clinical risk, because what is key for us is that when a member of our population, a citizen of our country who is not well, needing healthcare attention, when they come out of our hospital, the outcome should be better. We have to reduce morbidity, we have to reduce mortality, but we must present to ourselves, to yourselves, that we are ready. President Nelson Mandela indicated that the brave do not necessarily are people who are not afraid, but they're people that will manage their fear. So we will manage our fear against the Omicron or any other variant. We will remain focused as we face the third wave, the turbulence that the fourth wave is bringing. But we have the confidence, as we have been able to collectively and collaboratively manage the third wave together with the resources that were there, the South African National Defence Force that was there, the Doctors Without Borders that were there, the WHO, and all the the partners that have been available as resources for Gauteng Department of Health will be deployed collectively, collaboratively, to really combat the fourth wave. So, Honourable Minister, Honourable Members, the remarkable support we are receiving from the NICD, from the National Department of Health, and all other partner departments that have been working with us to make sure that the citizens of Gauteng, the citizens of South Africa are well looked after when they come into the facilities in Gauteng. We have been having ad hoc collaborations with our private sector colleagues in Gauteng. We will sustain those collaborations and engagements. We learn from one another, and we will continue to do that. But the last message that I have for my dear brothers and sisters in our communities is that let's not panic. I'm repeating what Prof. Abdul Salim said, let's not panic. Yes, we are afraid, but we are going to manage our fears and remain focused, use science, the resources we have, knowledge to respond and combat the fourth wave of the COVID-19. That was predicted prior that it might be taking place in December. If you are into it now, we will continue to monitor and take appropriate steps to respond to COVID-19. We want our people to be safe and alive. Thank you very much.
Thanks very much, Dr. Hongwana, for assuring us that as far as the province is concerned, you are ready for any eventuality. So without wasting any time, I'm going to call upon our panelist who's going to give us clinical observations as far as the patterns, the symptoms is concerned. That's Dr. Unben Pillay. Somebody was asking me through the WhatsApp. I'm referring to Dr. Anban. So here is Unben, but you can correct me if I pronounce the name very well. Over to you, Doc.
Thank you, Faustino. The pronunciation is perfect. It's Unben Pillay. Honorable Minister and Deputy Minister, good morning, and colleagues. I'm a general practitioner in private practice in Gauteng. And from our side, what we've seen is very similar to what the scientific panel have presented. Is we've started seeing increases in cases for around about 10 days now, with a very sharp increase. Prior to the 19th, I think, majority of general practitioners' cases were down to zero. In the general practitioner space, the cases are very mild, but it is early days. So we've seen patients present with flu-like symptoms, dry cough, fever, night sweats, and a lot of general body pains and malaise. And I think this is in keeping with all the other COVID waves that we've seen. We haven't seen a vast and a big increase in hospital cases or in pulmonary complications. But again, I think this is really early days for us as general practitioners. Generally, the cases that we see in private practice are milder cases. But as the waves in the hospitals fill up, we start seeing a lot of the complications. I think the general practitioners are very aware of how to manage patients. We've been doing it now for 3 waves. We have done a lot of upskilling in the last few days as well for general practitioners, so that we are aware on what needs to happen in terms of management and treatment with the fourth wave. But overall, I think our cases that we've seen is also positive cases in both vaccinated and unvaccinated cases. I think the vaccinated patients, definitely, we're managing them at home and we're managing them symptomatically. They tend to do much better. And we are, at the moment, starting to see this increase. And so we will know a lot more in terms of what the patient's presentation features are, or I think as we go along. Thank you.